The House Health Policy Committee will come to order. Will clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett. Carter.
Present.
Hadsma.
Present.
Neely. Glanville.
Present.
Kafia.
Here.
Conlon.
Present.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingens.
Present.
Vanderwall.
Present.
Filler.
Yes.
Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson. Madam Chair, you have 16 members present. You do have a quorum.
Thank you. Representative Miller moves to approve the minutes from our meeting on May 18. Seeing no objection, the minutes are approved. Today we will be voting on Senate Bill 59. We have a substitute for HB 4496 before holding a vote on supporting that bill, and we will send House Bills 4616 and 4617 to the Behavioral Health Subcommittee for their consideration. And finally, we will take testimony on Senate Bills 69, 70, and 71, which are part of the bipartisan, bicameral sexual assault prevention and education bill package. First on our agenda, we will be taking up Senate Bill 59, which we heard testimony on last week. And do we have any cards on that one? Oh, no, that we do. The DNR supports the bill, not wishing to speak. With that, I will entertain a motion to report Senate Bill 59. Representative Glanville moves to report Senate Bill 59 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter.
Yes.
Hadsma.
Yes.
Neely. Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Yes.
Filler.
Yeah.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 16 yeas, 0 nays, 0 pass. Senate Bill 59 is reported with recommendation.
Thank you. If empowering conservation officers to intervene in mental health crises saves even one life, this legislation will have been worth it. Next up, we will take up House Bill 4496, which we heard testimony on previously. In that testimony, we heard that a substitute was being developed, and you should have a copy of the H4 sub in front of you. Representative Filler, if you will please share the changes included in the HB sub.
Thanks, Chair. Very simple. The H4 sub removes language referencing work requirements, which were never the focus of the legislation, and the language was mistakenly included. It also removes language referencing dual eligibility for Medicaid recipients. That's Section 109F. And the purpose of the bill package is just to give flexibility to health plans to incentivize health care visits. And I move my substitute.
Before we move, I'm going to see if anyone has any questions. I know you're in a hurry to get out of here, Representative, but do we have any questions? All right. Now to adopt the substitute, the vice chair wanted to move it, but if you would like to override Representative Filler, that's fine with me.
I'll move myself.
Okay. Representative Filler moves to adopt the HB sub of House Bill 4496, House Substitute 4. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter.
Yes.
Hadsma.
Yes.
Neely. Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Madam Chair, you have 16 yeas, 0 nays, 0 pass. The substitute is adopted.
Representative, I do have cards to read in. We've got Michigan Poverty Law Program supports the bill with the sub 4496. We've got Health and DHHS, Health and Human Services, supports the bill. Frank Waters from Michigan Primary Care Association supports the bill, and Michigan League for Public Policy supports the bill. Representative Vanderwall moves to report House Bill 4496 and substitute H4. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Woodsett, Carter,
Yes.
Hadsma,
Yes.
Neely, Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz.
Yes.
Madam Chair, you have 16 yeas, 0 nays, 0 pass. House Bill 4496 is reported with recommendation as substitute H4.
House Bills 4616 and 4617 were introduced and referred to the Committee on Health Policy. It is my intention to have Chair Braybeck and the Behavioral Health Subcommittee work on these bills. Madam Clerk, please read in the provided letter.
A letter dated May 25th, 2023. Dear Madam Clerk, on May 23rd, 2023, House Bills 4616 and 4617 were referred to the House Committee on Health Policy. These bills prohibit mental health professionals from engaging in so-called conversion therapy with minors and defines the practices collectively known as conversion therapy. I am asking the Subcommittee on Behavioral Health to review and make recommendations to these bills, protecting LGBTQ youth from engaging in harmful counseling which attempts to alter fundamental aspects of a minor's identity. This legislation presents an opportunity for the subcommittee to delve into modern therapy practices and healthcare needs of today's youth while engaging all interested parties. I am confident that the subcommittee will be successful and productive. Sincerely, Julie M. Rogers, Chair, House Committee on Health Policy.
Thank you. So today is our last Thursday in May, and what is May, everyone? May is Movement Month in Michigan, so we're going to get up one more time and do a little happy dance, and then sit back down in a minute. So we will go at ease for a minute. Yeah. All right, so we're coming back to order. If everyone wants to take their seats. Committee on Health Policy will come back to order. We will next be taking up Senate Bills 69, 70, and 71, which I am grateful to have the opportunity to consider in health policy after the Senate acted on these important bills at the beginning of the month. Senator Chang and all of the sponsors of the bills in this package have worked diligently to get these bills to where they are today. Testifying in support of these bills, we will have the staff from the offices of Senator Johnson and Senator Houck, as well as Senator Chang. We will then hear from Stephanie Glidden, representing the Michigan Coalition to End Domestic and Sexual Violence. To speak to the bills, can we hear from Garrett Wheat, Chief of Staff for Senator Johnson, and Alex Porritt, Chief of Staff for Senator Houck. And then I think Ellen is coming up as well for question and answers to help us. Welcome, and begin when you are ready.
Thank you, Madam Chair. As you said, these bipartisan bills that you have in your committee today are part of a larger bicameral package of bills that will make a difference in preventing future sexual misconduct from happening, but also to make sure that when it happens, especially in a medical setting, it is punished appropriately. So since the Larry Nassar scandal at MSU, we've seen similar scandals that have come to light, including at the University of Michigan, as well as with a youth hockey team that's based here in Michigan. This bill package was first developed in 2018 here in the House. It was informed by hundreds of pages of documents and consultation with survivors, experts, community organizations, advocacy groups, educators, parents, and hours and hours and hours of testimony in the room across the hall for 6 weeks straight. The bills were passed with overwhelming bipartisan support in the House in 2018 and in 2020 and 2022, and they've been reported unanimously from the Senate Judiciary Committee in each of the last now 4 terms. I'm going to turn it over to Garrett.
Thank you, Madam Chair and members of the committee. Senate Bill 69 and 70, sponsored by Senator Tice and Senator Johnson, would prohibit medical professionals from performing treatments involving vaginal or anal penetration on minors unless it is within their scope of practice, a medical assistant or other healthcare professional is present in the room, and that the minor's parent or guardian has given informed consent. There are exemptions if the treatment is necessary for a medical emergency, if it is related to a urological, gastrointestinal, reproductive health issue, or done for a sexual assault examination. The bill also would require the Department of Licensing and Regulatory Affairs to create and update on a regular basis standardized consent form, which would have information for the parent or guardian, including things such as the gloves are generally worn during these exams. They have the right to request additional information, or if there are potential alternative treatments, that generally the provider could not be in the room alone with the patient while that exam is being performed. There would be criminal penalties for violations. A first offense would be a 2-year felony, and subsequent violations would be a 5-year felony. As Ellen said, this has been something that's been in the works for a long time, and Senator Johnson has sponsored the last few sessions. We're very pleased to see it finally clear the Senate, and we really appreciate the committee taking it up today, and happy to answer any questions at the end, but I'll let Alex from Senator Hawk's office explain Senate Bill 71 to you.
Yes, my name is Alex Porritt. I'm from Senator Houck's office, testifying on Senate Bill 71, which would require health professionals or health facilities to maintain documents related to examinations that involved vaginal or anal penetration. As others have mentioned, we're excited to see the momentum behind these bills, and we're very happy to have you guys taking it up today. When we reflected on the horrors of the Larry Nassar's case and the subsequent cases at U of M and others, kind of looked for solutions that could have assisted victims and parents sooner. And one of the many things that we saw in those cases is a lack of a paper trail. Now, in the Larry Nassar case, I don't think that guy would have necessarily documented those instances, but at least parents, investigators, and victims might have been able to piece together or, see those red flags for the lack of documentation. Similar to the bill you just heard, there are exemptions for medical emergencies, and I can list out all of the exemptions, or we can open it up for questions. But we have to maintain those records for 15 years, and the violations, it's $1,000 for the first violation, $2,500 for the second violation, and then the third violation, or if it's gross negligence, it can be a misdemeanor, and if it was intentional, it can be a felony with jail time.
Thank you. Are there questions? Representative Glanville?
I was just looking at Senate Bill 69, and where it talks about the exceptions to the written consent form. The third exception says that those provisions, the written consent form provisions, would not apply if the medical treatment procedure or examination is performed for the purposes of a sexual assault examination. Am I reading that correctly?
Correct.
So I guess I'm curious. I mean, it seems to me that if I had, was the victim of a sexual assault examination, I would be most comfortable knowing that gloves were being required and that I would have informed consent. I don't understand. I guess, can you explain why that would be an exception?
Yeah, so I think that, and we're open to exploring it as we worked with stakeholders, including the physicians. I think as you look through the list, the intent was to generally exempt those who would typically perform those types of examinations, as a course of their treatment. So if you are a gynecologist or you're doing a sexual assault exam, those would be expected examinations that you would give. And so the intent here is to try to capture medical providers where that's not really their scope, and yet they're doing this. And so not to say that would always be inappropriate, but then they should have that documentation, be explaining to the patient, have that record keeping, so that if they're doing those types of exams, and that's really not their typical practice. So I take your point, and we'd be open to discussing that, but that was the intent.
All right, so you're talking about these consent forms apply to physicians and that where this would not be their normal scope of practice.
Correct.
Okay, thank you.
Other questions? Going once, going twice? Okay. Thank you. We have some I'm going to read it in the cards a minute, and then we'll have Stephanie come up. Michigan Nurses Association supports all 3 bills. Michigan Catholic Conference supports all 3 bills. Michigan Poverty Law Program supports all 3 bills. Michigan State Conference for Junior Leagues supports all 3 bills. And then Stephanie Glidden supports the bill and is wishing to speak. Welcome, Stephanie.
All right, it's been a while since I've been up here. So, as said, Madam Chair, thank you for having me. I'm Stephanie Glidden. I have the privilege of being the government affairs consultant for the Michigan Coalition to End Domestic and Sexual Violence. They have their annual conference today, and so you get me, you get the obvious. But I am happy to take back, specifically, I know Rep. Gillen, your question to them and get a response as well if we thought we needed a little bit more, but. Yes, as I said, consultant for the Michigan Coalition to End Domestic and Sexual Violence. Heath Lowry is typically the face up here, if you guys know Heath. They apologize for not being able to be here, but we wanted to make sure we still got testimony in on these important bills that we've worked really hard in for a very long time on. The Coalition is a nonprofit membership organization made up of 73 agencies that provide services to survivors of domestic and sexual violence across the state. Their member programs serve every county in the state, including all of yours. They provide training, technical assistance, and advocacy for those member programs, including legislative education and advocacy such as this. The Coalition has a multidisciplinary policy team that works to advance legislation and policies that support survivors throughout Michigan. The Coalition is a national leader in the prevention of domestic and sexual violence and works to provide training and education to schools, hospitals, and professionals. Their members provide comprehensive services including wraparound sexual assault response services, forensic examinations, shelter, and advocacy. A violation of dignity, especially within the confines of a trusted doctor-patient relationship, can lead to lasting damage and often requires a long road to recovery. There is great value in laws that strengthen and support doctor-patient trust and seek to prevent future violence. Today, I urge you to support Senate Bill 69 through 71 and the rest of the package as it approaches you all. And that would add specific criminal sexual conduct charges and penalties where the assault was done under the pretext of medical treatment. These bills help protect survivors who were deceived by medical professionals they were supposed to be able to trust. Senate Bill 69 and 70 require health professionals, as previously stated, to have an additional person present and to obtain consent for certain delicate treatments and provide penalties for those who do not. These bills codify the best practice standards that are already being practiced by many concerned and diligent practitioners. Patients deserve care that is safe, thoughtful, and mindful of the imbalance of power that exists between patients and medical professionals when they're in a vulnerable, delicate situation. Survivors need to be able to trust their doctors, and when a doctor performs a delicate and intimate procedure involving penetration, they should be held to the highest reporting standards. This can protect survivors and their understanding of their medical treatment. For these reasons, I ask you to support Senate Bill 71 and their companions, and its companion 72, which requires the medical professionals to maintain the records as previously stated. They must be retained for 15 years and then destroyed. It also creates civil and criminal penalties under Senate Bill 72, its companion, for failing to follow those laws on the records intentionally or unintentionally. Keeping reports of procedures such as these are key to informed consent. This requirement will also encourage doctors and medical professionals to explain not only that they will be engaging in treatment that includes penetration for the patient, but why. Often patients are at the mercy of their care providers' expertise. They assume that because the doctor says that this is going to happen, that it must. It is our hope that reporting requirements such as these will remind everyone involved that true consent must include understanding. These bills have been painstakingly crafted and informed by weeks of committee hearings, hundreds of pages of documents, and consultation with survivors, experts, advocacy groups, and many more to close the gap in the existing laws that would allow future predators to get away with the heinous crimes of sexual assault. The Coalition is honored to have participated in the thoughtful process of crafting these bills, and we're confident that with your support and your leadership, that will make real, impactful differences in sexual assault accountability and prevention. So thank you all for your time. I'm happy to answer questions if I can, and if not, I'll definitely take it back to the Coalition, to the experts in the field, and bring that back to you.
Thank you, Stephanie. One clarification for starters. So 2 of these bills were House bills last time, right?
I believe so,
I think
yes.
it was 71 and 2. So we did, many of us voted on them, and they did pass the House last session, and then we're stuck over in the Senate. My question specifically, because I'm a physical therapist and our profession does pelvic floor therapy, it's a pretty common niche practice that this would fall under our profession. Can you talk about how the 15-year period for the records retention was decided upon? And it's my understanding that in a lot of standard medical practices, it's typically 10 years. So can you explain how we got to 15 and the rationale for that? Or you can follow up with me. That's
Yeah, I'm really sorry. I don't know that specific piece of negotiation or the intent behind the additional years there.
Okay.
But I know it was, as you said, a topic of discussion within negotiations and over the past several years. So I'll get that for you if you'd like that and give it to
Great.
you.
That's I appreciate that. Anyone else have questions? Representative Conlon.
Thank you, Madam Chair. Thank you so much for bringing this bill to us. In my former life as a journalist, one of the victims of Dr. Anderson at the University of Michigan called me up because he wanted to tell his story anonymously. He had not even told his wife what had happened to him at the hands of Dr. Anderson on 3 different occasions. And he was now in his 40s and had never been to a doctor since he had turned 19 and this had happened to him at the university. The trauma is real. We got his story out, but I'm really happy that this bill has come forward. Thank you.
Thank you.
And my other question, if no one else has one, is what happens if a minor is not wishing to have? So if they're having some kind of procedure that's kind of embarrassing, if they would not want to have another medical professional, is there room for that in this bill?
Yeah, it's my understanding that you need to have the consent of the minor as well as the parent in order to do the procedures.
Thank you. Vice Chair Vanderwall.
Thank you, Madam Chair. And I just want to make sure that I'm clear. Is there anything in these bills, or is there another bill package that addresses the victim and what their rights or what happens in follow-up with them and their mental health? Just curious if it's in a different, I hear it might be in a different committee, just curious.
Yeah, I think, so we've got, I believe, there's 14 total bills to this package split between the Senate and the House. Several of those are located in the Senate package, and then the House or the Senate package got dispersed between criminal justice and health, and then the House package is maintained, and it will have hearings next week in the Senate.
Thank you.
Any other questions from members? Well, thank you so much
Yeah.
to each one of you for
Thank you.
testifying. I know that the senators had some scheduling conflicts and were triple booked as usual, so we appreciate you all coming over. In the next meeting, the House Health Policy Committee will be on June 8th, and I expect to vote out Senate Bill 69, 70, and 71 at that time. Please share any other concerns that you think of with the bill sponsors or my office before then. Representative Reingans moves to excuse Representative Whitsett, Thompson, and Neely. There being no objection, the motion prevails with unanimous consent. I do have a request just to remind folks there is a Stop the Bleed training going on over at Heritage Hall from 11 to 1, so you can go get trained today for the Stop the Bleed program. And there being no further business before our committee will stand adjourned.